this lesson, I will be explaining the key points of disseminated intravascular coagulation and how you're going to provide care for this patient. The big picture idea to understand is that disseminated intravascular coagulation, also known as DIC, occurs when there's an overreaction of the clotting system. So the patient's going to continually clot and bleed, clot and bleed. It can cause intravascular thrombin and fibrin, resulting in thrombosis of vessels to the organs. The end result will be organ dysfunction because of these clots and severe bleeding. This is a very serious condition that is caused by an issue with the clotting cascade. So it's not working properly. We are over-clotting. This occurs in our postpartum patients because the placenta is detached. It's an open wound. So that's going to activate the clotting cascade to start. Many clots form quickly, and that's going to deplete our clotting factors. Now, if we have no clotting factors, then we have factors. If we have no clotting factors because we've depleted them, then we're going to have severe hemorrhage. So that's a huge risk with DIC. A hallmark symptom of DIC is going to be bleeding out of any orifice. So any hole the patient has, they're bleeding out of. So eyes, nares, rectum, ears, and IV sites even, so that where the IV enters, they can be bleeding out of that. Let's now look at our assessment piece and what this is going to look like. So the patient's labs, a lot of them are going to have decreased. We're going to have low hematocrit, low fibrinogen, and low platelets. Hematocrit is low because we're bleeding. Fibrinogen and platelets are low because we're using it up to make clots, and platelet aggregation is occurring. So our PT, PTT clotting time, and the fibrin degradation products, or FDPs, those are going to be increased. Clotting time increases because the body has used up the clots, so it's taking longer and longer to form clots. So longer to form clots. The FDPs, the fibrin degradation products, those are increased because the clots are quickly being broken down. So now that's going to be increased. Now with this understanding, let's look at the symptoms and what it's going to look like for our patient. So we have bleeding, right? Because we've used all the clots in the body, so there's bleeding happening because there's no clots left. There's going to be petechiae, and that's because of microclots that are forming. And it's happening right under the surface. So that's going to cause petechiae from those microclots. Tiny vessels are breaking and opening, occurring under the skin. So that's going to give that purpura. Sepsis and shock. So sepsis can often lead to DIC. So patients might have sepsis symptoms because that's a big cause of DIC. And then shock because we are bleeding. So shock symptoms, the high heart rate, tachycardia, clammy, paleness, cool, clammy skin, paleness. That is going to be our symptoms of shock. Now, if you have a patient with DIC, you're going to need to know how to provide care for this patient. So lab work needs to be drawn. So this is going to include our CBC, coagulation studies, and metabolic panels. So the CBC, we are looking at hemoglobin and hematocrit to see where we stand there. And then we're doing our coag studies just to understand the different coagulation pieces and where that number stands. And then metabolic panel, this is going to help us keep an eye on our organ function or dysfunction. So to keep an eye on that, since that's a big problem with DIC. Now, we are also going to be very watchful with our bleeding and ensure that the patient isn't bleeding too heavy. So just keep an eye on that, where the bleeding is coming from and how much they're losing. And then hemodynamics. So this is huge, right? We need to be watching our hemodynamics and then help to replace anything. So blood products, platelets, giving fluids, or even heparin. So the heparin piece can be a little bit confusing. So let me try to explain that a little bit better, because you're thinking, we're already clotting a lot. Why would we need to give heparin? So heparin is going to help stop the cascade, and that's what we need. We need to stop this cascade because it's not working right. The cascade is overproducing. So if we can give heparin, it'll help stop that cascade. And that way the body won't be using up its own clotting factors, and instead the heparin will be used. So if this helps, then they can be weaned off the heparin, but it can help resolve this problem. So there is also a lesson on hematology section on DIC. So if you need more explanation on that, you can refer to that section. And our last thing is prepare for surgery. So sometimes our patients are going to need a hysterectomy done because we got to take out what is causing this overreaction of the cascade system. So sometimes we might need a hysterectomy to remove that uterus. Our education is going to revolve around explaining what is happening to the patient. So a lot of this is very emergent. Everyone's working together very quickly, but we need to do our best to explain what's going on, and in terms that they can understand it. We need to let her know signs to report. So this would revolve around if she had a hysterectomy, infection, if she's feeling a temperature, pain, those kinds of things, signs to report, and then blood transfusions, obviously signs to report of a reaction. Our nursing concepts for someone with DIC are going to be clotting and perfusion, because we have an overactivation of the clotting system, and then this is going to be causing perfusion problems to the organs. There are a few key points to focus on just to kind of bring it all together. I know it's a lot of information. So DIC is an emergency, okay? So we have to act fast, but remember, we always need to do our best to explain to the patient what's happening. We are overclotting. There's way too much clotting happening, and it's not happening properly. So remember, this is going to form tiny clots, which is going to cause thrombosis of the vessels and lead to organ failure if we don't act quick. Bleeding. So bleeding can happen out of any orifice. So IV site is sometimes a big test question. We're bleeding out of IV sites because it's an opening. Decreased. So what's decreased? Our labs that are decreased. Hematocrit, platelets, and fibrinogen. And increase the clotting time, the PT, PTT, and FTPs. Remember, the body's bleeding, clotting, bleeding, clotting. Eventually, the body just can't keep up. Make sure you check out the resources that are attached to the lesson, and you can view the full explanation of DIC in our hematology oncology course. Now go out and be your best selves today, and as always, happy nursing.